Anxiety and Depression.
By Nicole Verhoeven and Mandy Whitehall.
Depression is a mental illness in which the patient experiences a decreased mood and other depression symptoms for a period greater than 2 weeks. Patients who are experiencing depression often report trouble sleeping, a decreased appetite, tiredness, decreased pleasure in usually enjoyed activities, a lower level of energy, feeling powerless and worthless, and increased suicidal thoughts. Depression is the result of chemical imbalances in the brain, which can be caused by genetic predispositions, decreased satisfaction in relationships, substance abuse, major life events, and disappointments at work or school. Anxiety is defined as an emotional state caused by the perception of real or perceived danger that threatens the security of an individual. Most people experience sensations of anxiety for a number of reasons, such as response to pain, fears, major life events, and decision making. Clinical anxiety is experienced for an extended time, usually over 6 months. Anxiety disorders are associated with chronic medical illness, low quality of life, and physical disability. These disorders impair the individual's ability to function on a daily basis and can be classified in several categories. These include generalized anxiety disorders, panic disorders, and social anxiety. Although these conditions appear very different, they are commonly found together. Anxiety and depression are more likely to be found together than an anxiety disorder on its own. They are both caused by chemical changes in the brain as a result of genetic and environmental influences.
The cause of depressive disorders is very complex. It cannot be fully explained by any one theory, and there are many different factors that interact that cause depression. The very first thing that needs to be done when evaluating someone who may have depression or anxiety is to eliminate the possibility that they have been caused by a medication. There are many medications that can cause depression and anxiety as side effects. Eliminating that does not make explaining these mental illnesses any better. Although no specific marker has been found, several biological abnormalities have been found in depressed patients. For example, 45 to 60% of patients who have an endocrine abnormality, including higher secretions of and lack of suppression of cortisol. Anxiety is also associated with many different regions of the brain and the dysfunction of several neurotransmitter systems. These can include norepinephrine, serotonin, corticotropin releasing of fear and anxiety. The parts of the brain associated with depression and anxiety are the amygdala, locus coeruleus, and the hippocampus. The amygdala is critical in the assessment of fear and the learned response to fear. The activity of the amygdala is elevated in a person who has depression or anxiety. The locus coeruleus is the primary site of norepinephrine and affects many other areas that are responsible for implementing a fear response. The hippocampus is important in the consolidation of fearful memories and the contextualization of fear. In depressed and anxious patients, this area tends to be shrunken, and the growth of nerves leading to this part of the brain is impaired due to repeated exposure to stress hormones.
The symptoms of depression include pain, especially headaches, difficulty sleeping, chronic fatigue, appetite disturbances, which can cause either significant weight gain or weight loss, and also decreased ability to perform the tasks of daily life. Mentally, symptoms can include poor memory, slower thinking, and a decreased ability to concentrate. More serious symptoms include muscle fatigue, cardiovascular, and gastrointestinal issues. These patients are often pessimistic and do not feel like anything can make them feel better.
The signs and symptoms of anxiety vary depending on the specific type of anxiety. An example, generalized anxiety disorder versus panic attacks. The symptoms of generalized anxiety disorders are excessive anxiety, worries that are difficult to control, feeling on edge, trouble concentrating, restlessness, fatigue, muscle tension, sleep disturbances, and irritability. The symptoms of panic attacks are different, including depersonalization, being detached from oneself, derealization, feelings of being detached from one's environment, fear of losing control, abdominal distress, chest pain, chills, dizziness, feeling of choking or shortness of breath, heat sensations, nausea, palpitations, tachycardia, and trembling or shaking. As you can see by the symptoms listed here, there is an overlap between depression and anxiety. These include things like fatigue and sleep disturbances, poor concentration and memory, and an interference with the activities of daily living.
Depression and anxiety are caused by a coagulation of stressful, threatening, negative, and upsetting or fear-provoking life events that, in combination, can lead the person into a depressed or anxious state. Chronic illness can be one of these events. There are genetic factors that play a role in an individual's susceptibility to depression and anxiety. These illnesses have been found to have a hereditary component because, if a family member, particularly a twin, has depression, a given individual will be more likely to have that disorder as well. This is why, when screening for depression or anxiety, the health team member will ask, does anyone in your family have a history of or has a mental illness? Primarily, depression and anxiety are due to chemical imbalance in the brain. This happens internally with no influence of a pathogen. Depression and anxiety are not contagious, nor can they be caught or transmitted. They are highly individual disorders that are due to the brain and nerve dysfunction.
Depression and anxiety are hard to prevent because they are chemically and genetically determined illnesses that are provoked during stressful times and events. For that reason, the most that can be done to prevent these mental illnesses are ensuring that the individual has a solid support system and good coping mechanisms for when they feel stressed, upset, or overwhelmed. Awareness of these silent disorders needs to be increased so that those affected can get the help they need. This, however, does not guarantee prevention, as they often use as management and relapse prevention strategies rather than initial prevention mechanisms. In this sense, depression and anxiety are typically looked at from a secondary and tertiary disease prevention lens. The supports of this illness are aimed at increasing detection early and having support systems and resources available for treating them.
Anxiety and depression can be difficult to diagnose because they are often overlooked, and they vary so much. A way that some studies have gauged depression is with rating scales. An example of this is the Montgomery-Åsberg Depression Rating Scale, which is commonly used in drug trials and a self-administered patient health questionnaire. There are 3 phases to work through for patients with a major depressive disorder. The first phase is called the acute phase. It lasts 6 to 12 weeks with the goal being remission or absence of symptoms. The continuation phase lasts approximately 4 to 9 months. The second phase aims to eliminate any residual problems and prevent relapse. The final phase is called the maintenance phase. The goal here is to prevent recurrence.
Antidepressants are the first-line treatment for depression. There is a great number of them, as you can see by this slide. The choice of which one to take is influenced by many factors. Some of these include a patient's history of response to drugs, what other medications the patient may be on, the drug response of other family members, present symptoms, patient preference, and the drug's cost. When taking medications, when taking medications is an issue with the patient, electroconvulsive therapy has been shown to be safe and effective. The medications here that are highlighted in the darker color are the ones that are most commonly used. Since the primary medication for treatment of anxiety disorders is benzodiazepines, it can be habit-forming and addictive. There is a focus for non-pharmaceutical treatment here in anxiety disorders. These treatments can include psychoeducation, short-term counseling, stress management, psychotherapy, meditation, and exercise. Psychotherapy is the least invasive and safest form of treatment. Anxiety medications are reserved for patients that have symptoms that are severe enough to produce functional disability. Benzodiazepines give rapid relief of acute anxiety symptoms. There has, however, been a shift towards using antidepressant drugs to help manage chronic anxiety. This is because of a lack of dependency and more tolerable side effects. And again, as with the last slide, the darker colored medications are the more common ones used.
The patient is a 17-year-old female. Her right leg was amputated below the knee after a car accident. She's an avid brunette player and even has a sports scholarship for university next year. With her current condition, she is questioning her future. Hi. So, my name's Mandy, and I'm going to be your nurse again today. I just wanted to start off by taking some vitals on you, okay? Alright, perfect. So, I'm just going to raise your bed up. How are you feeling today?
Tired?
Tired? Did you get a lot of sleep last night?
Not really.
No?
No.
Any at all? Or?
Every time I woke up,
Maybe.
she was awake, so I don't think she slept much.
If I did, it wasn't a lot.
No? That's not good. Alright, so I'm going to start off by taking your temperature, okay?
Alright.
So I'm just going to put your hair back a bit so I can get in your ear. Are you okay this morning other than that?
Yeah.
Great, so temperature is 36.9. We'd consider that normal. And now I just want to take your pulse, okay? I'm just going to take it on your arm here. Alright, so your pulse is actually a little bit high. It's 118. Are you feeling dizzy at all?
No.
Okay. We can look into that a bit further too, why it's that high. I'm also noticing that your respiratory rate, like the amount that you're breathing in and out, is a little bit high. Normally we want anything from 12 to 20, and yours is about 26. Are you feeling short of breath?
No.
No? Okay. No trouble breathing?
No.
Okay. I'm just going to take your blood pressure now, okay? Get that cuff on you. Alright, so it's about 142 over 90. So your blood pressure is a bit elevated as well. You're sure you're not like feeling dizzy or lightheaded or anything like that? No? Okay. Trying to figure out what might be causing that.
Do you have any ideas right now?
Right now, not at the moment.
It's nothing that's wrong with her leg right now, then.
It shouldn't be, no. Because we checked earlier for any signs of infection, nothing like that. Her temperature is normal. Are you in pain right now?
Pretty much always.
Always? So would that have started like after your surgery or?
Yeah.
Yeah? And what would you say like makes it worse?
Moving.
Moving? Just that area of your body?
Where my leg isn't.
Where your leg isn't? Okay. How would you describe the pain that you're in?
Throbbing.
Throbbing? And you said it's basically like just in that one region of your leg?
Yep.
So on a scale of like 0 to 10, with like 10 being the worst pain that you've ever been in your life, and 0 being no pain at all, where would you say that you are right now?
Like 5.
A 5? Okay, and what do you think is causing that pain?
Probably because there's not a leg there or a future.
Okay. What does that pain like mean to you? How does it affect you?
What am I supposed to do with my leg? Sports, forget was how I was going to get through school. Can't exactly do that with only one leg. Doesn't really work like that. So how am I going to get through school? Sports was like what I was good at in life. Now what do I have?
That must be hard for you. There are other options though, like you could still go to school and get an education, do what you love.
The scholarship was how school was going to be paid for. Don't think they're going to give a sports scholarship to someone who can't actually play sports.
I'm sure we can find out some way to pay for it, honey.
Okay, well I just want to go check your chart a bit and I'll be back, okay? Hi. Alright, so I just reviewed her medications. I don't see like depression or anxiety as like a side effect, but I am kind of concerned about her mental health.
Okay.
So I just wanted to talk a bit like about how you're feeling and that with you. So I want to ask, I know that you haven't been sleeping, but have you been like eating? Has she been eating?
No, not really.
No?
She might take an applesauce out of her lunch, but she really doesn't eat the whole thing.
Okay. Have you had an appetite?
Not really.
No? What about like your relationships with other people, like your mom or anybody else who comes to visit you?
I've noticed she's been distant. Like, we used to
Yeah.
have a really close relationship, and she's just not talking to me right now.
You don't get it.
But I'm trying to be here to understand, because I want to be a part of your life and know what you're going through. I know this is difficult for you, and I want to support you.
Would you be willing to like explain it to your mother? Try to explore that?
How do you explain not having a leg to somebody who has both?
Okay. She could still like help you out though, probably, and be there for you.
Sometimes it's good to talk about things.
How do you feel like about yourself? Like, how's your confidence now?
Not super great. Sports was what I was good at, and can't really do that anymore. So like,
Now you feel like you don't have your thing?
pretty much, yeah.
Well, maybe we could like try to explore like something else that you could do. Like, there's great like prosthetics now. Would you be interested in that?
Yeah, maybe.
Maybe. Okay. That might be a good option that like we can look into with the doctor. What about like when you're like say feeling like stressed and stuff, do you have like an urge to smoke or like abuse any like substance?
No,
No? How do you handle like when you feel sad then? How do you handle it?
with sports usually go for a skate,
What do you do now?
lie in bed.
Lie in bed?
Can't exactly get up and move around.
No. But maybe after physio, you could start doing some kind of sport again.
Alright. Well, I actually have something that I want you to fill out. It's just like a sort of survey. Would you be willing to fill that out for me?
Yeah.
Okay. So I'm gonna leave this with you here. So I'll undo you a bit. Alright, and then I'll just come back, okay? Actually, can I talk to your mother? Okay.
So the nurse voiced her concerns to the mother about her daughter's mental health based on the behaviors noticed during the assessment. The nurse also asked the mother about the history of mental illness within her family. The patient health questionnaire that the patient filled out indicated that she did have depression. Further discussion with the doctor will determine if the patient needs medication to control her symptoms.
So the patient health questionnaire that our patient filled out included rating the following 9 criterias on a scale of 0 to 3, with 0 being not at all and 3 being nearly every day. At the end, all the scores were added up, and a score of 1 to 4 indicated minimal depression, 5 to 9 was mild depression, 10 to 14 was moderate depression, 15 to 19 was moderately severe depression, and 20 to 27 indicated severe depression. The first nursing diagnosis that we came up with was response to perceived threat, that is, consciously recognizes danger, also known as fear. We chose fear because oftentimes when people are experiencing anxiety, they're asking what are known as what if questions. What if the surgery doesn't go well? What if I can't walk again? What if people see me differently? These types of questions are associated with anxiety. In our patient scenario, our patient is feeling the following defining characteristics of fear. The first one is a feeling of dread. Our patient is dreading their life after the removal of their leg. The second is feeling of terror. Our patient feels terror because they don't know how to live without their life, without the focus on sports. The third is a change in physiological response. Patients with fear, stress, and anxiety will often have increased heart rate, increased respiratory rate, and increased blood pressure. This was the case in our patient scenario.
So for the patient who is anxious and fearful, a priority of care should be to attempt to relieve some of that fear. A reduction in fear could help build rapport and a good professional therapeutic relationship. Fear can cause an inability to manage disease. A nurse can intervene in this to assess the source of fear with the client, and they can talk through the fear, which talking through the fear can help people distinguish between real and imagined threats. Another way to confront fear is by drawing it. This technique has been shown to work in adults as well as children by helping them overcome their fears. The first evaluation of progress is subjective. The patient could express that they have less fear. This could be confirmed by their vitals, lowering of heart rate or blood pressure. If fear is affecting a chronic disease, an alleviation or reduction in fear could produce a positive immune response, and the patient could be overall healthier.
Our second nursing diagnosis is powerlessness. This is defined as the lived experience of lack of control over a situation, including a perception that one's actions do not significantly affect an outcome. In our patient scenario, our patient is feeling the following characteristics of powerlessness. Frustration about inability to perform previous activities. Our patient wants to be able to play sports but might not be able to again because of their amputated limb. Dependency. In our example, our patient will likely need to depend on others to help them learn how to amputate with a prosthetic leg. Doubt about role performance. In our example, our patient senses that they won't be able to be the all-star athlete again that they once were, and will have to find another job, hobby, etc. Alienation. In our example, our patient was in a severe car accident and had a surgery, so they spent quite a bit of time in the hospital in this situation, oftentimes alone. Insufficient sense of control. Our patient never chose to be in a car accident and had no control over the loss of her leg.
So for the patient that feels powerless, a priority of care would be to reduce the factors that make them feel this way and encourage them to take control over the aspects of their life that they can. A nurse can assist this by watching for factors that contribute to powerlessness. These are things like immobility, unfavorable prognosis, and no support system. Make sure to listen to patients and discover what their most important concerns are. A nurse can also encourage the patient to take control of as many activities as possible. Even if it takes more time, a patient should be given the opportunity to be more dependent. To evaluate this intervention, again, the patient could voice that they feel more in control of their life. Something more measurable would be the monitoring of a progressive increase in activities that the patient takes on by themselves.
Anxiety and depression can make it impossible to perform tasks of daily living. It affects the person's sleep, appetite, motivation, sex drive, and work performance. This not only has an effect on the patient, but their family and friends as well. These relationships can be strained and separated by these conditions. For example, people with depression may isolate themselves from other people that are close to them. It is very important to educate the patient and their family on health promotion strategies that can help increase resistance and response to stress and depression stimuli. These include regular exercise, the importance of support systems, time management techniques, and relaxation techniques, and journaling.
Guys, it came back.
She can play sports again!